You're listening to Vet Candy.
This show is brought to you by NexGard Combo.
Want one-and-done monthly protection for your feline patients? Then you want NexGard Combo, Essofoxyloner, Eprinomectin, and Praziquantel topical solution. NexGard Combo is the only topical solution that protects cats against fleas, ticks, heartworm disease, roundworms, hookworms, and tapeworms, all in one easy monthly application. Use with caution in cats with a history of seizures or neurologic disorders. Digestive side effects have also been reported. Learn more at nextguardcomboclinic.com today.
In a significant leap forward for veterinary care, on June 26th, the Reassessment Campaign on Veterinary Resuscitation, more commonly known as the Recover Initiative, unveiled the first major revisions to its global veterinary cardiopulmonary resuscitation guidelines since 2012. These updates set new life-saving standards based on groundbreaking scientific advancements and extensive community feedback. The initiative is led by 3 co-chairs, including Dr. Manuel Boller, an adjunct associate professor of veterinary emergency and critical care from the University of Calgary and specialist in veterinary emergency and critical care at VCA Canada. Dr. Boller had this to say.
I think the key thing also was that those guidelines have to be current, right? So we are permanently evaluating ongoing evidence and try to extract and learn from that newly published scientific evidence on how to improve everything we do in veterinary medicine, including CPR. This was not so much triggered on it itself by a particularly groundbreaking change, but rather something that we continuously do. And so now, after more than 10 years, it was absolutely necessary to work on those new guidelines and get the veterinary community a new, updated, super current set of those guidelines that describe on how to do CPR best. And then there were, of course, changes. There were significant changes. Like at some point, for example, epinephrine altogether, whether to give it or not, was put into doubt. That there were some new randomized controlled trials in people in out-of-hospital cardiac arrest patients where they, for example, looked into whether giving any epinephrine would be beneficial or not. And believe it or not, there was not really a big difference on whether you give epi or no epi. Other changes were regarding cooling post-cardiac arrest, and this is not yet the post-cardiac arrest care portion is not yet included in this most recent release. That's something that we're still working on, but that has completely changed how aggressively we actually cool patients that are initially successfully resuscitated to protect their brains afterwards. And there is now a more lenient approach to it. So we don't have to cool everybody down to 32 degrees anymore. We can just cool them to any degree, even 36 degrees or 37 degrees is probably protective. I think the new message there is to just absolutely avoid any type of increase in temperature above normal. So there are those kind of things that come out. But I think in principle, it is just also listening to the people and finding out what they think the previous guidelines did for them and whatnot. There is, of course, a lot of consensus-based changes that we propose as well. And that is sadly, and this evidence evaluation showed that again, sadly, because we just simply don't have hard evidence for many of those things. There's no randomized controlled trials in dogs and cats in our target species that those guidelines are for to really support any of those things in absolute terms, right? So there's always the indirectness, extrapolating the data from swine, from rodents in some instances, and of course also from clinical trials in humans, and trying to see how that translates to our patient population.
The Recover Initiative is the internationally recognized authority in veterinary CPR. Spearheaded by a team of veterinary emergency and critical care specialists in 2010, its mission is to develop and disseminate the first evidence-based veterinary cardiopulmonary resuscitation guidelines. Over the years, Recover has empowered veterinary professionals, and pet owners worldwide through education, science, and community. These guidelines serve as the definitive CPR protocols for veterinary health professionals worldwide. They incorporate new scientific evidence, feedback from the veterinary community, and the latest advancements, directly enhancing how CPR is performed on pets. Dr. Boller explains more.
Yeah, so what the guidelines are about is to basically move the evidence to the clinical floor, right? And so what we basically did is take all that evidence and extract from it through a systematic evidence evaluation, but also through a consensus process and a community commenting process, into useful recommendations for the practitioners, because evidence alone in isolation will not do anything, right? It's just collecting dust on the shelf, essentially, for lack of a better word, right? So we need to kind of really put it on the floor, and that's what recovery is about. And so that's why we have a research domain, and then that kind of creates new knowledge, right? That really tries to figure out what are the knowledge gaps and how can we, as a group, coordinate the research to fill those, that then creates evidence that we can then use in the guidelines, and then ultimately guidelines through education need to be applied on the clinical floor. That is really, really important. I would say the educational component is paramount. And so as part of those educational efforts, there are tools and resources that we use, and those are the algorithms that you mentioned, right? So those are kind of cognitive aids, as we refer them, that really people can hang up over their resuscitation area, and that guides them through the process. So now our new cognitive aids are much more intuitive. We have less text, more pictograms that kind of try to give the people the impulses that they need right there and right now, right at the bedside, on what to do if they, in the heat of the fight, so to say, forget a couple of things. And so yes, there's the algorithm, there's the dosing chart, there is a rhythm decision aid, basically, that helps them figuring out what it is a shockable or non-shockable rhythm, and those things. So that's all part of the implementation process of the guidelines. It's really important. And so the educational initiatives are important, and getting it to the man or the woman on the floor, really important.
The revised guidelines introduce essential changes that reflect the latest in veterinary science and practice. These updates are available in an open access issue of the Journal of Veterinary Emergency and Critical Care and the Recover Initiative website, recoverinitiative.org. Key updates include chest compression techniques, enhanced methods for cats and small dogs to optimize survival during cardiac arrest. These techniques are based on the latest research and clinical findings, aiming to improve the efficiency and effectiveness of chest compressions. Compression depths and techniques. Adjustments tailored to an animal's size and chest shape, improving CPR effectiveness. The new guidelines specify different compression depths and hand placements for various sizes and breeds of animals. Breathing support methods. Revised for non-intubated patients, focusing on rescuer safety. The updates provide new recommendations for providing ventilation in situations where intubation may not be possible. Medication dosages and procedures. Updated for more precise and effective treatment during CPR. The guidelines now include revised dosages for medications used during resuscitation, ensuring more accurate and effective pharmacological support. A new streamlined CPR algorithm, updated drug dosing charts, and an ECG diagnosis algorithm will standardize CPR practices globally. The enhanced race-approved training courses, developed by the Cornell University College of Veterinary Medicine in collaboration with the Recover Initiative, are set to equip over 350 Recover-certified instructors worldwide to train veterinary professionals in these life-saving techniques. To date, over 85,000 veterinary health professionals have taken the Recover online CPR courses, and over 20,000 have attended in-person CPR rescuer workshops. Experts from around the world and across various disciplines collaborated to develop the treatment recommendations. The 2024 Recover CPR Guidelines are the first veterinary clinical guidelines developed using a rigorous process known as GRADE, grading of recommendations, assessment, development, and evaluations. This process is commonly used by major human clinical guideline organizations, including the International Liaison Committee on Resuscitation, which produces human CPR guidelines. The use of GRADE ensures that the Recover guidelines are based on the highest standards of clinical evidence and practice. The primary goal of the Recover 2024 CPR guidelines is to improve CPR outcomes in veterinary patients. These guidelines, training courses, and an official certification process underscore the importance of preparedness in emergency situations, particularly in general practice settings where reversible causes of cardiopulmonary arrest, such as anesthesia-related issues, present opportunities to save lives. The Recover Initiative calls on veterinary professionals to embrace these updated guidelines immediately. Adopting these practices is crucial to enhancing acute care outcomes for pets, ensuring the best possible results. Further guidelines on newborn resuscitation, prevention and preparedness, and first aid are expected in the near future. The Recover Initiative, a not-for-profit leader in evidence-based CPR guidelines and training, has empowered veterinary professionals, and pet owners worldwide since 2012 through education, science, and community. With a network of over 350 certified instructors, Recover sets global standards in life-saving care. For more detailed information on the updated guidelines and access to training resources, visit recoverinitiative.org.
We'll be right back with more Vet Candy.
Want one-and-done monthly protection for your feline patients? Then you want NexGard Combo, Essofoxalunar, Eprinomectin, and Praziquantel topical solution. NexGard Combo is the only topical solution that protects cats against fleas, ticks, heartworm disease, roundworms, hookworms, and tapeworms, all in one easy monthly application. Use with caution in cats with a history of seizures or neurologic disorders. Digestive side effects have also been reported. Learn more at nexguardcomboclinic.com today.
Recover Initiative unveils major updates to veterinary CPR guidelines. Elevating Emergency Care for Pets was written by Dr. Jill Lopez and is brought to you by Boehringer Ingelheim. If you liked the show, head over to Apple Podcasts, Spotify, Stitcher, or wherever you get your podcasts. Hit subscribe and leave a rating while you're there. It really helps others to find our show. On behalf of Vet Candy, I'm Clay Palmer. Thank you for listening.
It's Vet Candy.
Vet Candy.
It's Vet Candy Radio.